Good morning or good afternoon, depending on your time zone. Welcome and thanks for joining us for today's HIS Talk webinar, looking at the big picture for strategic communications at Children's Hospital Colorado. It's brought to you by Spoke. I'm Lori from HIS Talk and I'll be moderating. I have a couple of housekeeping items to make you aware of before we start the webinar. Attendee phone lines have been muted to prevent background noise. Please use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you'll receive a link to the recording as well as a PDF version of the PowerPoint presentation. Our presenter today is Andrew Blockman. Andrew's the Chief Technology Officer at Children's Hospital Colorado in Denver. To kick off Andrew's discussion, we'll first hear a few remarks from Hemant Goyal, who is the President of Spoke. Hemant?
Thank you, Lori. Good afternoon and good morning to those on the West Coast. My name is Hemant Goyal and I'm President of Spoke. I have about 30 years of experience in healthcare information technology. So prior to joining Spoke, I was a General Manager and Vice President of Clinical Solutions at Siemens Healthcare. And before that, I was at Cerner as General Manager for a few of the enterprises. And prior to that, some various companies like Imnet, First Data Corporation in various roles. I have a bachelor's degree in mechanical engineering and an MBA from Queen's University in Charlotte. So let's just jump right in as to the seminar and what this webinar is about. If you look at the screen, there are many challenges in terms of communication and solutions. And those of you who are very familiar with EMRs and implementation of EMRs, takes you back to the days of when there were a lot of departmental solutions from different companies and different organizations that weren't quite talking to each other. They were interfaced. Similar concept and communication challenges today. There are alarm integration requirements, on-call requirements, texting, critical test results, and typically these systems don't easily talk to one another and don't have access to directories and on-call schedules where you can do the right communication at the right time. A lot of interfaces are involved, and everyone is managing their own set of call information, call directories, in their own context. While this is not these interface solutions, these are not ideal, and just like all other solutions, most organizations would like to have a single platform, single solution where they can make it work. As a result, this is when Spoke Care Connect comes in. So we at Spoke have been developing these solutions and services for a while, where in the context of Spoke Care Connect, all of these solutions like secure texting, alarm management, clinical alerting, etc., they all work on directory and schedules and preferences on a single platform, single integrated unified solution, and the communication fits into the workflow seamlessly. That's what Spoke Care Connect is about. And to give another analogy would be, if you go to the systems, remember any of these different departmental or these specific solutions, like WordPerfect, word processing, Lotus 123 for Excel, and Harvard Graphics for what we use today as PowerPoint. Well, over time, Microsoft Office became the de facto standard, simply because it had a single backend, single shared architecture, and all the information could move seamlessly from one to the other, and is now pretty much the most prevalent Office suite. Very similar approach on the Spoke Care Connect side, where we have taken all these different disjointed communication requirements and put them on a single platform. So hopefully what you hear today from Children's Colorado is how they have set their strategy on Spoke Care Connect and are moving forward in deploying these solutions to solve their workflow challenges in communication. With that, I'll turn it over to Andrew. Andrew?
Yes, thank you, Hemant, and good morning and good afternoon to everyone who is on the call. I hope you find this presentation to be well worth your time. Today, what we're going to be talking about is Children's Hospital Colorado's journey with Spoke. We've been a customer of Spoke since 2012, and we have had an iterative process that has progressed over the years, and so I'll walk you through some history of both the organization as well as our technical journey with Spoke and the lessons that we've learned along the way. The focus or the purpose for today's meeting is to let you know that not only how Children's approached deploying Spoke technologies, but as Hemant mentioned, it's really a iterative process that we've gone through, but it's a big strategic communications focus area where other organizations can wind up looking at unified communications from a more strategic view and a big picture view of the ways we want to integrate communications successfully into the business. So I hope that you'll find some valuable lessons learned from our process, and then also some ways that you can transform your business more effectively by not necessarily repeating some of the mistakes that Children's has made over the years in the past. So that's what's coming. In the meantime, here I am. So I'm CTO at Children's Hospital Colorado. I've been in my role for roughly 4 years. I started at Children's in 2007 as a unified communications engineer, and I've got a background of, well, first of all, I have a bachelor's degree in information systems from Colorado State, so go Rams. And I have, prior to Children's, I worked at Cisco, Level 3, Amgen, GTRI, and a few others. I have a number of technical certifications, most namely the CCNP Voice and Design Professional. So I'm originally from Boulder, so I'm one of the very few Colorado natives, so we call ourselves an endangered species as the state is growing so fast. So now a little bit about Children's. The most important thing you need to know about Children's Hospital Colorado is that we're a silent hospital. And what that means is prior to 2007, we were like a lot of healthcare organizations where codes and different kinds of communications or pages were broadcast overhead through a PA system. So as we grew as an organization, we decided very strategically, in 2007 we moved to a new campus, which I'll tell you about more in a moment. And as part of that move, we decided we wanted to change the way that we do business. And one of the things that's really important to Children's is patient and family-centered care. And part of that whole care experience is that we didn't want families to feel interrupted and hearing all sorts of things like code in room so-and-so, and you know, nurse Jane Doe, please respond to room so-and-so. So we wanted to try and you know, hide from the customer view the whole experience about getting clinicians to the right place. And so that means that we're heavily reliant on technology, and this is where Spoke is so interwoven into our care delivery here at the organization about streamlining communications and getting clinicians to the right bed at the right time as seamlessly as possible, but without disrupting the whole patient-family experience as we come into our walls. So here's some history about us. We were founded in 1908, and actually there's a really cool picture here of the original building that was in downtown Denver. We had 30 beds when we originally opened, and actually the original quote was well-equipped institution with a capacity of 30 beds back in 1909. In 1917, we moved out of this building and into this one is the building that we occupied from 1917 through 2007. It was renovated a number of times throughout that time, but we basically were one organization within one building, and we really were limited to doing business out of that one site. In 2007, we moved to this, and this is our new home out in eastern Denver. We're in a suburb called Aurora. And we grew substantially in this location, but the other thing that happened during this time is that we expanded also regionally. So we now occupy 16 locations across primarily the Front Range of the Colorado area. So a few things. So we are a level 1 pediatric trauma center. We're the only one in Colorado. So the most significant trauma events that happen inside our 7-state region all get transferred to Denver for care. We've grown substantially, so we're actually closing in on 700,000 outpatient visits last year, and we treat kids in a 7-state region. We're really proud of being one of the best children's hospitals in the country. In fact, we're ranked number 5 this year on the best children's hospitals in the country according to U.S. News and World Report. We're also the highest rated children's hospital west of the Mississippi, which is something we're very proud of. This organization has also become magnet recognized for the last 3 years, which is a really difficult feat to accomplish, so we're really proud of our nursing team. And from an IT standpoint, we're extremely proud that we've received the Healthcare's Most Wired Award from 2003 through 2015, so 3 years running receiving that award. Lastly, probably the most prestigious award on this page is that last year we were awarded the American Hospital Association McKesson Quest for Quality Prize, and this award goes to a healthcare system that basically has demonstrated that quality and care delivery and outcomes are interwoven throughout the whole service that we provide. And basically the whole drive is to reduce risk, reduce preventable harm in health institutions, and make healthcare safer. Children's was the first children's hospital in the country to receive this award, and we were really honored and pleased to receive it. And Spoke really plays a critical result or a critical part of that, because it is the system that we rely on very heavily for codes, for nurse call alerts, and making sure that we're getting the right care, or the right clinicians to the bedside in a very timely manner to ensure that kids are getting the care they need from the right care providers exactly when they need it. So now a brief history, as I mentioned in the opening. So in 2007, we moved to our new organization, or the new building out in Aurora. And as part of that new construction project, we selected a code paging system. So it's basically a 900 megahertz paging solution. So we installed an antenna on the roof. And we used this paging solution to basically issue codes. So the workflow is this, is we had a nurse call alert that would go through the phone system and then hit what we call the PCDs, or the Cisco wireless phones that are in our infrastructure. And if it is a true code, then the second responder into the room would dial the operator on the emergency line. The operator would then log into the paging system and issue a code page, which would go out over this 900 megahertz antenna system to a series of in-house pagers, and then everyone would go running to the bedside. And notice that, number one, we haven't broadcast anything overhead. It's all relying on technology. And number two, it is pretty seamless in terms of relying on these integrated workflows. And the Spoke is not in the picture yet on either of these two systems. In 2012, the campus expanded pretty radically, and so we installed or built out an East Tower, which is basically a almost doubling of the size of the building that we originally occupied in 2007. So more or less, we went from about 300 beds up to well over 500 on the main campus. And during that construction process, through the design phase, it was quickly realized that the existing 900 megahertz antenna system that was installed in 2007 wasn't going to be adequate to reach all the new construction spaces that were going in with the East Tower. So a redesign was needed. Unfortunately, the vendor that we had originally selected in 2007 was no longer in business, and so we had to do a selection for what we were going to do for code paging at that time. So in 2012, through that process, we selected Spoke Messenger as being the replacement system. So one of the challenges that we had was that we ran into a lot of issues in later part of 2012, early part of 2013, with end-to-end reliability of the paging system. And this wasn't necessarily Spoke's fault, but basically we were relying on relatively unintelligent 900 megahertz pagers. So what we could prove was when a code page went out, that it would basically, in the workflow one more time, is that nurse call alert goes out, it goes through the middleware solution and onto the Cisco wireless phones, and then if it is a code, then the second responder into the room dialed the emergency number, spoke to the PBX operator, and the PBX operator would manually type in to the code paging system, hey, there's a code in this room, and then it would go out through the Spoke system out to these 900 megahertz pagers inside the organization. So when a code would go out, number one, it's super high priority, and we've got to get the right clinicians to the bedside as fast as possible. And then number two, unfortunately, there were instances that we noticed in 2012 and other words, where clinicians might be in a stairwell, they might be in an area where their pager was out of reach, maybe their pager was low on batteries at the time, and so for whatever reason, they didn't report hearing the page or receiving the page in the timely manner. And so a trouble ticket, urgent one, would get opened, and they would say, hey, we didn't hear the page and we were late responding, or maybe we didn't know about it at all and heard about it after the fact for maybe one clinician out of 50 or so. But even so, that's still one clinician who needed to respond. So what IT found ourselves in a place of was we would troubleshoot the Spoke system, and we could see absolutely the PBX operator seeing that the call came in, typing the message, and we could prove without a doubt that the message went out through the antenna system and the page was delivered. But what we could not prove is that which devices received it, how long did it take, any of those sorts of things. So that proved to be very difficult to troubleshoot. And in the end of the day, our best course of recourse was, well, we'd have to go into basically some circumstantial evidence. Were you in a stairwell at this time? What were you doing? And, as time drags on, people don't clearly remember what exactly they were doing. And so we would wind up preemptively kind of replacing some pagers or batteries, but not really stabbing at what the real issue may or may not have been. So that made overall obtaining timely, quality technical support, both within Children's as well as from Spoke, was really challenging. So in 2013, this is later in the year, we were building a brand new campus, which is our biggest remote site to date. It's about 1/3 the size of our main campus in Aurora, and it was in South Denver metro area, so a lot of times we refer to this as our South Campus. It has a mix of inpatient beds as well as operating rooms, and it has a large scale of outpatient ambulatory procedures that go on there as well. So South Campus is pretty critical. It's not just outpatient. Like I said, there's surgeries, there's inpatient. We see cancer and blood kits there, cardiology, all sorts of specialties. So having a nurse call system and a code paging system there is critically important, just like in our main campus. So given the lessons learned that we had surrounding the reliability of our 900 megahertz system on the main campus and some of the challenges that we were experiencing up until that time, I decided to take the team on a different journey. And instead, we wanted to try and deliver a more intelligent endpoint in the hand of the clinicians so that we could prove beyond a doubt when a code page or a nurse call alert went out, it hit the device, and then we would basically be able to see in a log file whether the person acknowledged the page, how long that took, and if they declined it, if they didn't answer, or if the device was turned off. And then if the case of where the person didn't respond or the device was turned off, that the system was intelligent enough to either escalate up a workflow or keep trying that person until they did respond, and all those things had to be logged. So we found that Spoke had that capability if we integrated it with our Cisco Unified Communications Manager system. And so we decided to do that. So the change for South Campus is we did not install a 900 megahertz antenna on the roof, and instead we integrated Spoke with Cisco Unified Communications Manager and sent both responder 5 alerts for nurse call as well as code pages to the Cisco wireless phones that we call PCDs, which also eliminated the number or limited the number of devices that the clinicians were forced to carry as part of their jobs. So some things we learned along the way with that was that on the main campus of the hospital, we were using Responder 5, our nurse call system, to integrate to Call Manager using a different middleware solution called Radianta. And frankly, we were never really thrilled with Radianta. The way it integrated to Call Manager was using SNMP to poll the status of the phones. And so one thing we found about Spoke right off the bat is that it uses Cisco telephony interface that we found to be more reliable right off the front. So we liked the way it was architected better than what we were using on the main campus for nurse call integrations. We also noticed that formatting the messaging initially was a little bit challenging. But with some work with Spoke and also on our internal IT team, we were able to format the nurse call messages appropriately for the staff to get the right information in their phones at the time of the code going through. And then the other thing we noticed was on the Radianta system on the main campus, if a clinician turned their volume on their Cisco wireless phone all the way down, the Radianta system was able to override it. Spoke at the time was not able to override the volume setting, so that was a little bit of a concern, but we remedied that with training and communication. So as we moved in, the results that we saw was the reliability of the paging system end-to-end at South Campus was much improved compared to the 900 megahertz solution on our main campus. So we saw that at South Campus, when a code page went out, it was logged all the way through. We could prove when somebody said they didn't receive it, whether their phone was turned off or it was out of, it wasn't registered to Call Manager, or maybe they just didn't, it rang it, but they didn't respond to it. And so it took a lot of, it gave a lot of visibility into exactly what was happening, and it improved our ability to support and troubleshoot much more effectively. The other thing we saw was the reliability of the nurse call alerts was just as good as Radianta on the main campus, so we had no concerns with that. I already mentioned the timestamps. That was really good. And then this dramatically improved both internally as well as with Spoke our ability to troubleshoot and provide good technical support when someone said, hey, I didn't receive a code page in a timely manner. And actually the incidences of that went way down as we moved to the Wi-Fi system versus the 900 megahertz solution. So all positives. So in 2014, we continued to build on the successes that we saw at South Campus. During a separate selection project, we were looking for a on-call scheduling solution. So for our operators to be able to locate the right doctors and page them out. So we did a selection. We looked at several different vendors with a project manager assigned and did a separate selection, and Spoke was selected with the whole Smart Suite to fulfill that solution. Then I wanted to only support one middleware solution across campuses for our Responder 5 integration to Nurse Call. So we launched a project to retire Radianta and replace it with Spoke so that we were similar on our main campus versus what we were doing at South Campus, and we were able to do that. And then we started looking at Spoke Mobile. So at this point, that's the app that runs on smartphones. And so a lot of physicians, actually this is sort of a grassroots operation, a lot of the physicians were carrying USA Mobility pagers, and they began to directly contact Spoke and start retiring out their pagers and instead translating to Spoke Mobile on their phones so that we could just carry a smartphone rather than a smartphone and a pager. The results we saw for that were we were able to lower our operational expenses by eliminating a middleware solution. So, healthcare is always really cost-focused, and that was very appreciated. The providers really were happy to give up their pagers once that they saw that the app on their smartphone was more reliable. The other thing about that is that the app gives you the option to run on the Wi-Fi for the hospital network and then switch to cellular. So there's some inherent redundancy of carrying a Spoke Mobile app on a smartphone than there is on carrying just a separate pager. So the docs really have accepted and embraced that pretty well. And like I said, the most impressive part about that from my standpoint is that it was a grassroots operation where the docs on their own decided to start rolling this product out rather than an IT project to say, hey, this is what you're going to do. So actually, I think that's probably the biggest set of kudos I can give at the time that it's a good solution. Just like South Campus, we didn't have any issues on main campus when we moved our nurse call over, other than, like I said, the only concern really was the whole silencing of the phones and override, but we were able to combat that and just work through it as a training issue and communicating, and it really didn't wind up being an issue. And just like South Campus, we saw that the logs and the timestamps were really advantageous, both on the code paging environment as well as on the nurse call alerting side. So that greatly improved our ability to support the paging system. One of the things, and this is a big lesson learned for us though, is that as we grew, you may be counting in your mind, but we started with Spoke as a code paging system, which is one workflow. Then we added another workflow, which is the nurse call alerting workflow. And then we added another workflow, which was the on-call scheduling workflow. One of the things that I feel like we did not do a very good job of was selecting a team that was going to manage and own the system overall. And so unfortunately, we kind of took a siloed iterative approach, as I mentioned earlier. And so the code paging team was really owned out of the PBX operators. The nurse call integration was really owned by our unified communications engineers. And our on-call scheduling piece, the Smart Suite, was really owned by our a group that we call One Call, but oftentimes called the PBX or the operators. So we have two separate operators groups. So as you can see, as a ticket would come into the help desk, it wasn't immediately clear which group that they were going to escalate to. And then it also became trouble. I think it was a little bit troubling for Spoke because they would get calls from children's from a bunch of different groups that didn't quite have the big picture about all the things that the system was doing for the organization. So I think we had a little bit too distributed approach rather than declaring an overall system owner. So last year, in 2015, we launched 4 new projects, and unfortunately, we all used the same iterative approach. So we did a selection. We treated these all as sort of as in silos, unfortunately. So they all had separate project managers. So we wanted to roll out secure SMS for our providers. So there was a selection project that started, and the vendors that we brought in for this RFP were TigerTex and Spoke and Extension and Volt. And anybody who started to do research on any of those vendors knows that Spoke and Extension and Volt are all sort of direct competitors, and there's a lot of product overlap between those different vendors. We're also interested in alert fatigue, so limiting how many alerts go to the clinician's hands and looking at things like pumps and vents and pulse ox monitors and all that sort of stuff. And so there was a project that was rolling with that with yet a separate project manager, and we were looking really seriously at Volt and Extension for those things. And you'll notice that Spoke wasn't even in the mix on that selection. Then our radiology, our cardiology, our lab teams were all looking at how can we get better about critical results. And in that case, our radiology team in particular was really interested in Spoke. And then out of IT, I was pushing a project that, hey, we need to start thinking about moving away from these Cisco wireless phones to the next generation of mobile device that's more capable and provides texting and all those sorts of functionalities and barcode scanning and in a much more cohesive workflow rather than having multiple devices that fulfill basically the same thing. And so we started working through all 4 of those different projects with a separate project leader and kind of a siloed approach. And as I started to look at this and what we were doing, it's when I decided to call a timeout, because clearly this doesn't make sense. It's time to really stop and see the big picture. And this is, if you take nothing away from the webinar, I hope you take this, is that Spoke by its nature, along with Extension and Volt, I mean, they're all really a hub of communications tools in your infrastructure. And in order for a health system, I think, to be very more efficient and more strategic in the decision making than unfortunately Children's was as we went through this iterative approach, I think it's really advantageous for health systems to have a very strategic vision for what the problem is that they're trying to solve. So rather than looking at code paging versus nurse call integration versus one call or paging out providers and the whole smart suite piece, I think it would have been much better if we would have just done one selection, really looked at the capabilities of those 3 systems as true competitors back in 2012 and taken a much more strategic big picture look at the product landscape and then selected a strategic partner that we were going to build our communication strategy with. So that being said, and that lesson learned under our belt, we decided to take I've kind of been working with the business to lay out, hey, where we're trying to go. And this is kind of what we do today, is we have, barcode scanners that we use for medicine administration. We have legacy VoIP phones. In our organization, we've got about 1,700 of those things. Almost everyone carries their own personal cell phone. A lot of docs still do have their pagers, and then we still do have code pagers that run on that 900 megahertz antenna system. And so there's a lot of devices that people are carrying, and a lot of times actually we do joke about the IT issued suspenders so the scrubs don't fall down, but we need to start moving away from that. And what we really want to try and move from is from this whole set of madness that we have to maintain and manage and all that sort of stuff, and people have to carry and devices get broken and lost and yada yada. We want to move away from all that to one more capable device. And there's a number of different options. I realize I've put up a screen share of a Motorola device, and now that's actually a Zebra device. But there's a number of different options that are on the product landscape that are either based on the Android or the iOS platform. And the point of this slide is we haven't made a product selection at this point, but we want to move to a more capable end user device, no different than what we're doing in all of our personal lives with many of us are carrying smart devices that have a number of different apps and do a whole bunch of workflows in our personal life. We want to deploy the exact same thing in a healthcare grade device for our clinicians. So with that said and the vision in mind, what we're looking to do in 2016 is we're continuing to look at the product landscape for our mobile devices, once again iOS and Android based, and we're looking at a number of different vendors regarding that. We want to continue moving forward with Spoke Mobile and transitioning both for the provider text messaging, but as well as nursing and other workflows. I think we're going to start centering on Spoke Mobile as being the primary vehicle in which both nurse call alerts, code paging, and critical results are all delivered and interacted with the clinicians, as well as text messages back and forth. We made a strategic decision to wait for the new version of 4.2, Spoke Mobile 4.2, to get released, and we plan to start rolling that out once that comes early this summer. And then, like I said, cardiology, radiology, and lab all are very interested in the ability to communicate critical results through this new vehicle and be more effective in communicating with the providers and really streamlining, hey, this critical result is in, you can look at it, logging those transactions end to end as those communications are sent. So once again, the vision for the future is we're just strategically going to focus on driving to one device and eliminating excess devices that people are carrying wherever possible. We want to drive to one middleware solution, and part of the strategic part of that vision is that we really want to focus on alert fatigue and getting our arms around all the different alarms and alerts that interface with the clinicians on a daily basis. One of the concerns I have about having multiple middleware solutions is I don't think you can be really selective and intelligent about alert filtering and analytics about what your clinicians are doing on a daily basis if you have parallel paths to get to your clinicians. So for instance, if our pumps and vents are going through one middleware solution and then ringing phones that providers are carrying, but we're using nurse call and patient monitors are using yet another parallel path to get to the same device using a separate app, it's very difficult, or I can't really actually honestly see how you would do it, to try and do intelligent filtering and or prioritization and analytics surrounding how clinicians are getting interrupted throughout their day. So you really have to, in my opinion, drive down to one path and then get some intelligence built into that path about prioritizing the workflow and the messages that go to the devices that people are interacting with. So at this point, we're kind of midway through the year already, which is amazing, but we've kind of settled on a tentative solution. We're looking at devices, Android or iOS based. We definitely need a barcode scanner because we want to do patient scanning as well as barcode scanning for medicine using Epic Rover. And then we're looking at soft phone clients, possibly Cisco Jabber, although some of the devices actually have a pretty robust SIP client built right into them that we're looking at as well. And then, of course, Spoke Mobile for delivering all the alerts and the code paging and the things that we had spoken about earlier. And possibly video, which is a video conferencing system that we're using for telemedicine, and seeing if there's any possibility to leverage that technology for telehealth. Other things not on this list is there's been a lot of talk about training, and a lot of these new continuing education apps are delivered on a mobile platform, so that may be another area of economies of scale that we can deliver to clinicians and get them more effective. We may do things with internal communications or homegrown mobile apps that now we would have a footprint to install those things on. So it's really exciting as we get a more intelligent device into the clinician's hands, all the different things we can do with that vehicle and really streamline care delivery and communications, no different than what we're doing in our personal lives every day. So the roadmap for us to be successful in this strategy is the following. We really have to create a robust strategy for mobile devices and unified collaboration. So there's a lot of different pieces to that. One of the most commonly overlooked ones is the wireless strategy. So unfortunately, this is an area where Children's got a little bit behind. So we deployed our new campus in 2007, and our wireless infrastructure was, of course, designed and deployed at that time. And one thing that's really amazing is how many additional wireless devices have come on the network since 2007. To illustrate the point, I'll just ask you to think how many people in the audience carried a Wi-Fi device that basically would sync with their email system back in 2007. I know I didn't. I had a relatively unintelligent flip phone at that point in time. So over time, now what you're seeing is, people are carrying tablets, they're carrying multiple phones, and all of it syncs over Wi-Fi. We've gone from wired connections on desktop computers primarily to everyone carrying laptops. So as a society, we're getting much, much more mobile, and all those things have a tax that are getting placed on our wireless infrastructure. So when you start to think about really critical communications, such as Spoke provides for code paging and nurse call alerts and critical results and all those really critical workflows that are paramount of importance, we've got to make sure that the wireless is architected in such a way that we can be successful. So don't overlook wireless, and make sure that you have adequate scale and QoS and other design issues that you're able to support all these things as they come on the network. The other thing that I have not mentioned is that we're seeing much more Internet of Things in the hospital in general. So we're seeing more pumps and vents and pulse ox machines that are all coming on Wi-Fi capable. And so you really got to really take some time and attention and really think about your Wi-Fi and be strategic in how you invest in your Wi-Fi network, because it's going to support critical communications such as Spoke. The other piece of that is just as important as Wi-Fi is you really need to pay some time and attention focusing on your cellular connectivity as well. So in the antenna system, so the distributed antenna system, need to make sure that that's reliable, that it covers stairwells in places that maybe Wi-Fi is not. And the reason why that's so important is for the providers who are carrying, often personally owned devices. When they get a page, Spoke will send it out through Spoke Mobile, and it will come out via Wi-Fi, but if the Wi-Fi is not available in the place where the provider is standing and they do have cellular, it will switch over and run on cellular. So having both systems available and strong signals on each actually gives you a certain degree of redundancy that you wouldn't get carrying traditional pagers. So once you've focused on the core infrastructure strategy and driving to one device and what apps you want to select and all those sorts of things, which middleware platform you want to look at, and being more strategic in which hub or Spoke or Volt or extension, which partner you want to use, you want to make sure that you've interwoven that all into a very well thought out communications strategy. And that's really what is on children's or on the health systems. On Spoke's side, we also need some help. So there's some things that right now Spoke's architecture relies on a number of different servers, and fortunately a lot of them are highly available. But I think you really need to underscore how critical this system is going to be as part of your infrastructure, and make sure you're doing everything possible end to end to design it in such a way that you're going to maximize your uptime, because your most critical communications are going to run through the system. So whatever you can do to invest in resiliency and in high availability end-to-end from the onset will actually play out in your favor in the long run, even if it is a little bit more expensive up front. The other thing that we really need from Spoke, and I know that this is getting worked on, is true enterprise-grade monitoring and alerting. So we want SNMP reliability and polling of the whole system so that it proactively monitors itself and then communicates with IT personnel that, hey, such and such service on this one box is not working, or system. So we need to be more proactive rather than waiting for pages not to go through to end users. So we want to make sure that we're continuing to develop a enterprise-grade monitoring system relying on SNMP, and that we're being proactive in our alerting to IT support staff. There's a lot of work, and I think this is a really hot topic for health systems across the country right now, is getting their arms around this alert fatigue or workflow optimization. Basically what I mean by that is, alert filtering, getting smart about the workflows that we're giving to the end users, and as we condense down to, or converge down to one device in the clinician's hands, and we've converged down to one middleware solution, it's going to be really important that we optimize the workflow and the user interface with that one device to make it as efficient as possible. So a lot of thought needs to go into that, and I think there's a lot of work on both the Spoke side as well as the health system side to make sure that we're designing a system that's optimized for the clinicians and doesn't become cumbersome in any way. And we've really clearly thought through the workflows and the escalations and the messaging so that the system is really optimized for care delivery. And so the key word there, if you didn't get it, was optimization. One of the things I think that's really powerful as we drive down to one middleware solution is we have an opportunity to start delivering rich data and analytics, and you can start using that data. Imagine how powerful it would be is if we could start charting end to end from, hey, a nurse call alert went out, a code page got issued, how many clinicians using our RTLS system responded and how long did that take? And then, how could we could write real big metrics or have initiatives that would be much more targeted now to improving the response time to actual events as they happen at the bedside. And so there really is an opportunity here to use data and analytics to improve outcomes for kids as well as adults and other health systems. And then, of course, Spoke is, I have to give kudos to Spoke here. So that we've come a long way, both Children's and Spoke on this, but there's still always things we can do better. So this is a mission-critical communication system inside healthcare, and it has to be supported on both sides as such. So I think that there's always work to be done, both inside the health system as well as with Spoke, on delivering the best technical assistance in a timely manner as possible. So on the healthcare side, or the health system side, I really highly suggest that you select a clear product owner, whether that's your unified communications team or your business apps team or whoever it winds up being. It could be on your clinical apps team. I don't think it really matters. You need to clearly define what skill set needs to be included in that team so that they can properly escalate all issues relating to Smart Suite or the databases or the unified communication systems, etc. And make sure that you have the right skill sets for the right engineers and clear ownership and clear escalation on the health system side so that you're minimizing the time to resolve and troubleshoot various issues as they may come up while you're supporting the system. And then on the Spoke side, we would need to make sure that when a ticket is opened, it's treated as a critical case, that it's escalated appropriately, and that we make sure that we have the best, most capable technical support team available, that in the event that things do happen, that we've got support from the vendor side to make sure that we're supporting the system just as it is, which is a mission-critical unified communications vehicle. One of the things I think is challenging not only for Spoke but all the competitive products that's in the landscape is that it's highly dependent on things that I mentioned earlier: Wi-Fi, server infrastructure, storage, the cellular distributed antenna system. So this solution, whether it's Spoke or a competing brand, is only going to be as good as the infrastructure that lies underneath it. And Spoke cannot, it's unfair for the health system to expect Spoke to support the whole thing end to end. So I really think paramount for Spoke's continued success is going to be to leverage vendor partners in different spaces to ensure that the Wi-Fi network, the server infrastructure, storage, the distributed antenna system, all those things, unified communications infrastructure, that all those things are supported in best practices, and that basically we deliver an end-to-end service. So if you take nothing else away, that's really paramount. Think about the big picture of what you're trying to solve, how you want to interweave communication throughout your whole health system, and what are your strategic priorities? What are all the different ways that you can leverage this technology to really shape communications and improve outcomes along the way for the kids and the adults that you serve in your health system. And deliver it as a service. Design it as much high availability as you can, and think about the end in mind. Design this as a service, and then you have to support it as a service as well. So those are all my formal comments. I hope you found that worthwhile and you learned something about the children's journey along the way. And I'm going to stand by for questions at the end. But for now, I'm going to turn it back over to Hemant. And thank you very much for your time. I hope you found this very worthwhile.
Thank you, Andrew. Great piece of information. Lots of good details. Can't thank you enough for taking us through the journey about things that children's did well and lessons learned that help others avoid and not repeat your mistakes that you all figured out. We are very proud to have Children's Colorado as a prestigious organization as part of the Spoke family. I'll just close with two things. You started out by the objective for Children's, which was patient and family-centered care, so that all communication happens in the background while you try to get the right clinicians to the right bedside and streamline communication. And then the most importantly, you said if you take away one piece or one piece of advice on this webinar was stop, take a look at the big picture, arrive on your strategy, and then once you arrive on it, go start executing on the details. So thank you for giving those two pieces of advice and information, and we will open it up for questions.
Thanks, Hemant. Now we'd like to open it up, as he said, to the audience for questions. As a reminder, please use the questions section on the GoToWebinar panel to submit your questions. The first question, Melinda would like to know, Andrew, if you're using Spoke Directory.
Yes, we are. So that's the Smart Suite. So the workflow for us is we have a one-call group. A lot of organizations use that as the operators. But basically, what one call is in charge of is they run a call center. So when a call comes in, they basically look up anesthesiology or radiology, or you get the idea, whatever specialty it is, or either by physician name or by specialty, and then page out the appropriate provider using the directory. So yes, we are using that. That is the Smart Suite platform.
Thank you. How did you obtain input from the clinicians?
So, you know, this is an area, frankly, that we could have done a little bit better, I think, because one of the things that we did, if you recall back earlier, I said that we took a very iterative process. So clinician input was involved on each silo as it was done. So, you know, when we did the first selection project for a new code paging system, there were providers who were on the selection committee for that technology. When we did Smart Suite or the on-call scheduling selection project where Smart Suite was selected, there were providers on that selection committee. So we've had clinician input end to end, but I found myself since 2015 when I decided to call the timeout, as it were, I think we could have done better up front, having a much more strategic view and having key provider stakeholders involved end to end in those conversations. So the risk we ran as an organization, and this is a key point, the risk we ran was we selected a secure SMS product, and Spoke Mobile was selected through that initiative, but it wasn't focused at all on nursing. It was really just a provider team. So because we weren't taking a strategic view, and then when we rolled back to talk about alert fatigue and some of the other things that are much more nursing focused, we could have easily, if we hadn't called timeout, what if they had selected extension? Now we've got two separate parallel systems that would have been potentially in place, and communications between those two systems would have been probably pretty non-existent. So I think it's really important to have a much more strategic, broad view of this, and get clinicians involved both from nursing and providers, and have the big picture in mind from the beginning, and you'll be much better positioned than we did using that iterative process.
Okay. Are the regular PBX operators combined with the one-call group, and to whom does the one-call group report?
The one-call group and the PBX operators are separate. So the PBX operators currently for us, gosh, I can't remember in the command and control structure like where everybody reports to. I believe one-call reports up through nursing for us, and I believe the PBX operators roll up through customer experience. So they're separated out even at the director and VP level. So the difference is this: the PBX operators in our organization are really responsible for answering calls on the main line. So like for us, it's 720-777-1234 is our main line for our organization. So the PBX operators will field calls off of that and transfer them as appropriate. The other thing the PBX operators do for us is answer our emergency lines, which are really the ones that I talked about throughout the presentation where codes would get called. So that's what the PBX operators do. The one-call group is really focused on provider communications and paging out docs. And so in our organization, they're two separate workflows and two separate groups.
Okay. Barbara would like to know if call forwarding is available, and does the individual doing the paging have to know who to call, or will it forward to the appropriate personnel?
So Spoke has got workflows built into it. So basically, to do it right, you have to spend a lot of time focusing on your workflow and the escalation path for these messages. The beauty in the system is it's automated once you've done that programming. So if I send a code page out and it's meant to go to I'm making this up a little bit, but it's meant to go to respiratory, and the person who's on respiratory on call for the code doesn't respond, it can escalate up to the manager of respiratory or other groups within the respiratory workflow. But you really need to do some time thinking about the escalation paths, and then the system will automatically escalate up. Same thing's true for critical results and other things. So that kind of answers the forwarding, I believe.
All right, that was our last question. Thank you, Hemant. Thank you, Andrew, for a very interesting presentation. It was very informative. As a reminder to attendees, watch your email for links to the recording of today's webinar, as well as the PDF version of the PowerPoint presentation. We look forward to seeing you at our next HIS Talk webinar. Enjoy the rest of the day.